مراكز علاج الطبية، رواد الصحة النوعية، أول شبكة طبية متخصصة تغطي خدماتها السعودية، الإمارات، مصر، قطر ولندن. علاج بلا حدود.
Erectile dysfunction is very common. Indeed, most men suffer from it from time to time, and it commonly occurs as a result of anxiety or worry or tiredness, or if you just don't feel very well for whatever reason. But when difficulty with erections becomes regular or continuous, then there might be some more serious underlying cause. Common causes include poor blood supply to the penis, which is quite common with advancing age, particularly in people who have trouble with the circulation and with the heart. Diabetes is another common problem, and indeed diabetes and heart disease commonly go together. Whenever there's any suggestion of a problem with erections, then much the best thing to do is to go and see a specialist about the subject to see if they can help. Usually, simple counselling may be all that's necessary, and indeed for some people, rather more detailed counselling might be appropriate. For others, further investigation with a view to pharmacological or surgical treatment might be appropriate. And there are various tests that can be done to see whether or not there is a problem that can be helped with the use of medications or surgery or not. Almost everybody these days has heard of drugs like Viagra, and Viagra is very often the first line of treatment, and indeed sometimes all that's necessary is a trial of Viagra to see whether or not that helps, and that is both diagnostic and treatment as well. There are other drugs like Viagra, of which Cialis, Snafi, is the best known, or another one is Levitra. And with these pills, the majority of people who need treatment can be helped. Sometimes treatment needs to be a little bit more aggressive, but very often the combination of controlling diabetes, if there is any, improving the heart and circulation, if there is a problem there, controlling anxiety, where anxiety or depression are a problem, and the use of an appropriate drug like Viagra is all that's necessary. When that doesn't work, then sometimes more detailed investigation is necessary with a view to either a rather more specific sort of treatment or else surgery. But by and large, the vast majority of patients can be helped in whatever way is necessary.